Hello all, welcome to Sakshi TV and welcome to your favorite NRI show, Ask Your Doctor. Today we have in the studio our esteemed guest, Dr. Gopika Banker. She is a board certified physician in internal medicine and nephrology. She's also the section head for Jefferson Health, New Jersey. She's also medical director of inpatient dialysis unit at Jefferson Health. So without any delay, let's welcome Dr. Gopika Banker.
Hi, thank you for welcoming me. I'm a board certified nephrologist, like you mentioned. My main practice is in southern New Jersey. I practice out of Voorhees, New Jersey, but we have locations in Washington Township, Sewell, Hamilton, Cherry Hill. I obviously provide care in English, but I also am very fluent in Gujarati and Hindi. We also have colleagues that speak Spanish and Italian, so we provide care for a variety of patients. As you mentioned, I am a board certified nephrologist. I'm a fellow of American Society of Nephrology, as well as a fellow of American College of Osteopathic Internists. I serve as the vice president for the medical staff at Jefferson Health, New Jersey. I also sit as the internal medicine section head for Jefferson Health, New Jersey, and am the inpatient dialysis unit medical director. I also serve as the medical director for outpatient medical dialysis unit at Fresenius Care in Berlin. I'm a associate professor for section of nephrology for Rowan Medicine. I became interested in nephrology at a very young point in my medical career because a close relative of mine had sudden kidney issues. Since then, I was very intrigued by how the kidneys really relate to the rest of your body and other disease processes. So here we are 13 years later.
That's really good, Dr. Gopika. I'm really amused by your background and the way you got interested into this. Can you please let me know what are the kind of disorders that you deal with?
I provide care for patients with chronic kidney disease, hypertension, various electrolyte disorders, including low sodium, high potassium, low potassium, high calcium, kidney stones, genetic disorders, and glomerular disorders. When kidney disease is severe enough where the patient requires dialysis replacement, we provide dialysis services, which could be in an in-center or at home, including home dialysis, peritoneal dialysis, as well as nocturnal dialysis. If a patient has severe kidney disease where they have now received a kidney transplant, I also provide care for post-transplantation.
How do we know that we have a kidney disease? And are all kidney diseases permanent?
That's a very good question because most people believe that if I pee fine, my kidneys work perfectly fine. But that's not necessarily the case. I can't look at somebody and say, oh, this is your kidney function and this is your kidney function. When we have chest pain, we go, something must be wrong with our heart. When we can't breathe, we say something's wrong with our lungs. But kidneys, there are no specific symptoms. Kidney function symptoms really start when kidney function is so severe. So the only way to tell if something's wrong with your kidneys is to get routine blood work and a urine test. We use a value called creatinine to determine what somebody's kidney function could be, and it only really provides as an estimate as to what the function rate is. The urinalysis tells us if there is other damage going on as well because we check to see if there's protein or blood in the urine. So those two values are very important and the only way for us to determine if somebody has any kidney damage. We take kidney problems and we divide them into two sections. Acute, which is reversible, or chronic, which is irreversible. So for example, acute kidney injury can occur if, let's say I was nauseous, vomiting, appetite was not good, I had fevers or chills. When I reverse that process, I get hydrated again, kidneys will get better. Another scenario would be if I had a kidney stone or urinary retention from an enlarged prostate and the urine's just not draining. Once we get rid of that obstruction, kidney function will get better. The second problem, which is chronic kidney disease, occurs over time slowly, and that unfortunately is irreversible. But early detection helps because then we can talk about things that we could do to help prevent progressive loss, keep the blood pressure under control, diabetes under control, avoiding medications that could be ongoing and harmful to the kidneys. We divide chronic kidney disease into 5 different stages. Again, there's no way to tell by looking at somebody who has what kind of kidney disease except to get the blood work done. the more severe it is, the more progressive it is. So chronic kidney disease stage 1 means your GFR or kidney function is pretty well preserved, but you have other abnormalities. Chronic kidney disease stage 5 is where we're getting closer and closer towards dialysis.
That's good to know, Dr. Gopika. So regular checkup and regular blood work are the key, especially like a lot of people in South Asia and India, they don't do regular checkups. So this is a very valuable information for them.
Chronic kidney disease progresses slowly over time, and there are certain diseases that put you at high risk for chronic kidney disease. Diabetes, high blood pressure, being overweight, exposure to certain medications and heart disease are really typically the common reasons why our kidney disease progresses. When we're born, we're actually born with about 110 to 120% kidney function. So as we get older, our kidneys start progressing a little bit, but those diseases definitely make progression of chronic kidney disease much quicker. The only way to really know what to do at each stage of that chronic kidney disease is to make sure you have a follow-up with a kidney specialist.
Hypertension is super common nowadays, and especially in South Asians. Can you tell me, is there a specific reason behind it?
South Asian population definitely has increased risk of hypertension for several factors: lifestyle, genetic composition, as well as exposure to certain environmental factors. From a genetic standpoint, we do know that 60% of South Asians carry a genetic variant that causes them to be more susceptible to salt. We also have a diet that's very high in sodium. So if we consume a high salt diet and genetically we're predisposed to being very salt sensitive, blood pressure will rise. Overall, we know that we're getting more sedentary. If I want groceries, log on to Amazon Prime, it can be delivered. I want something, we're not leaving and walking around as much, being more active. So that sedentary lifestyle has increased the risk of obesity, which then definitely goes towards predisposing more risk for hypertension.
That's exactly, what you have mentioned. Most of us do that. We don't have an active lifestyle, especially with the COVID and all of that.
Absolutely, COVID definitely made it worse.
I have gone through your website, and we know that you also deal with glomerular diseases. Can you explain in detail about them?
Sure. So the kidney is actually a very intricate organ, and it's made up of what we call nephrons. And that's what these little things are. They kind of look like straws. So nephron gets divided into two parts, something called the glomerulus and then tubules. And each part of the kidney really does a lot of different things. It's responsible for making hormones that regulate your blood pressure. It's responsible for production of hormones that regulate your bone health, as well as production of a hormone that can regulate your blood count. The glomerulus is really the main portion of the kidney. It's kind of like a filter, or, for layman's term, like a chalni, a sieve. So its job is to really retain what we need and then create this filtrate. And the rate at which it filters is the glomerular filtration rate. That's what we're checking to see what somebody's kidney function is. The urine that gets made and passes through the tubule is the final product, but then it goes through an intricate amount of regulation between how much salt to lose, potassium, water, calcium, and other electrolytes. So glomerular disorders are basically disorders that occur because there is a filtering problem in that first portion of the nephron. We divide them into two different types, either nephrotic or nephritic. Nephrotic is where there is a disability in the glomerulus where protein starts to leak. Those patients will usually present with hypertension, edema, low albumin, and high cholesterol. There are many reasons for nephrotic syndrome. The other disability that can occur is inability to filter blood properly, and now blood leaks into the urine. We call that nephritic syndrome. Often those patients will present with rapidly progressing kidney disease. This is why urinalysis would be important, because that's where that would get picked up before something becomes severe enough. Once we detect on urinalysis that there's protein or blood in the urine, then a kidney doctor would do an extensive amount of blood work, including a potential renal kidney biopsy, which would then help us guide the next therapy.
Dr. Gopika, you also do genetic testing. So is it true that genes and kidney are related?
Absolutely. We know that there are certain genetic disorders that are common to patients with kidney disease, and it's actually common in South Asian populations. So genetic disorders are basically inherited disorders that can occur. And there are several risk factors for this, especially if we were to look back, which I know is not as common, but marriages within a smaller community where you're a third or fourth cousin of somebody. That's definitely a risk factor. Lack of awareness and lack of access to genetic testing definitely plays a factor. There's two genetic disorders that are actually pretty common in the South Asian population, one of them being autosomal dominant polycystic kidney disease. In this, what actually happens is in the kidneys, cysts start to develop. So the kidney enlarges, and as the kidney enlarges, the good part of the kidney, the inside of this, starts to squish down. And therefore, the kidney itself, the good part, the filtering component, starts to scar. And those patients then eventually end up on dialysis. The other one that's very common is something called Alport syndrome. In this, basically, blood gets leaked through the urine as well as protein. Those patients often present with hearing loss at a very early age. Thankfully, in this country, we definitely have options where we can do genetic testing to detect these genetic disorders.
So are younger generation prone to a lot of kidney diseases and hypertension?
So when we look at studies from currently and compare them to previously, we do know that our generation and going forward, there's going to be an increased risk for chronic kidney disease as well as hypertension compared to our older generation. There's several factors that attribute to this. We've seen that there's a rise in obesity, that this rise in obesity increases your risk for diabetes, hypertension. We know diabetes and hypertension as well as obesity are increased risk for chronic kidney disease. So when you really think about it, it actually becomes a continuum. We're living a lifestyle where things are easily accessible. Processed foods have increased, saturated fats have increased in our diet, salt intake has increased on top of a very sedentary lifestyle.
That brings us to our next question. Can you suggest some lifestyle changes that we can incorporate in our lives for better kidneys?
First and foremost, to start with, a regular checkup with a primary care doctor is of utmost importance. I would recommend getting routine blood work at least on a yearly basis. And if you have underlying diseases like diabetes and high blood pressure, heart disease, high cholesterol, then more routinely as per suggestion of your doctor. I would recommend that your blood work should also include a urine test so we can assure if there's protein or blood in your urine. If you do have diabetes, I would recommend keeping diabetes under good control is very important. And that's because we do know that the more uncontrolled the diabetes is, the quicker the progression of kidney diseases, meaning the quicker the loss occurs to end stage. So the recommendation for patients with chronic kidney disease is to keep their hemoglobin A1C, which is a 3-month blood sugar number, to be below 7. Closer to 6.5, wonderful. If you have high blood pressure, same thing. Keep your blood pressure under good control. Avoid saturated fats. Maintain a low salt diet, low carbohydrate diet for diabetes. Goal blood pressure for patients with chronic kidney disease is to maintain the value less than 130/80. I do also recommend that if you're someone that likes to use herbal medications, please at least review them with your primary care doctor. We do know that over-the-counter medications aren't always regulated. Herbal medications are not regulated by the FDA. We have found that there are medications that can cause kidney disease and attribute to progression. One of the most common over-the-counter medications we typically use is Advil, Motrin, Aleve, ibuprofen, naproxen. I have a headache, my joints hurt. It's very easy to get it. However, those medications belong to a class of drugs called non-steroidal anti-inflammatories. If you actually look on the bottle, it'll say NSAIDs on it. That's what you want to avoid, because we do know that that leads to kidney disease in the short term, meaning that acute component, as well as chronic kidney disease. Now, we do say Tylenol is okay, but Tylenol does have its own little problems with the liver disease. So I would definitely try to avoid excessive use of Advil, Motrin, Aleve, ibuprofen. Another commonly utilized medication is something called Celebrex or Mobic. We use them for arthritic pain. I do think that those in the long run we do know that those in the long run can cause kidney problems. Also, it's important that if you do have kidney disease, you have somebody looking at your medications, because medications get filtered either by the liver, the gut, or the kidney. And if you do have kidney weakness, some of those medications may not get filtered properly. Not that they cause kidney damage, but buildup of the medication can cause its own slew of problems. A healthy lifestyle where you're staying active, staying mobile will definitely help. Eating, less processed foods, saturated fats, low salt diet, low carbohydrate diet will be of importance. Avoidance of tobacco and alcohol will definitely help.
Diabetes is the common topic that we've been talking about. So can we talk about diabetes in relation with kidneys?
As you know, diabetes isn't just a blood sugar problem. It's really an entire body problem. And we know that it affects the kidneys. It's actually the most common reason why patients will end up on dialysis. And that's because what happens in diabetes is it starts to affect those glomeruli that we were talking about, and it can start causing protein leakage to occur. And we can often see that protein leakage occur even before the kidney function starts to come down. This is why obtaining a urine test is very important. If we notice that there's protein on the urine test, then we'll quantify or check exactly how much it is, because that tells us a different story. We have patients that have preserved kidney function, but high amounts of protein, and they're just as much of a risk of dying from heart disease, having progressive kidney disease, and needing dialysis sooner, as will a person whose kidney disease is really weak, but does not have as much protein. So, it's really not just about the number, it's also really about the function, and that requires a full picture. Now, I will say there are medications that are available that can help protect the kidneys. So what they do is they help control blood pressure, they protect the heart, they protect the kidney, and they minimize that protein leaking in the urine. They belong to a class of drugs called RAS inhibitors. So an example of that would be something like lisinopril, enalapril, Zestro. And also there's another class that falls within it, and those are losartan or Cozar. There's a lot of those medications that belong to that class. There have been many advances in the recent couple of years where we've learned that in addition to using just those RAS inhibitor type drugs, there's something called SGLT2 inhibitors, and those type of medications also protect the heart, protect the kidney, minimize the protein, but can also help with the blood sugar control. So it's very important to talk to your doctor about the right type of medications for you. There's several other medications that are available, especially if you have protein excretion that's continuing on, and we can add them to medications that you're already on. There's medications that can actually control diabetes, help you lose weight, which will indirectly help your kidney function. Those class of medications are called GLP-1 agonists. So it's very important to obtain routine blood work, see the consultant, have a conversation about your health. I do want to mention, though, none of these medications reverse your kidney function. The goal, once the chronic kidney disease damage has occurred, is not to reverse it, because that is irreversible by definition. However, these medications can help prevent rapid progression, going from 30% kidney function down to 15 very quickly. So they can help slow down that progression. That's what they're helpful for.
How can hypertension, kidney issues affect pregnant women?
There are several issues with hypertension and pregnancy. There could be just undiagnosed hypertension. Just mom didn't know because she didn't go for routine follow-up, because if you feel fine, you don't get follow-ups. Those patients will typically present with hypertension at 20-week gestation or prior. If we notice high blood pressure in a pregnant patient who's 20 weeks or after, that's typically what we call preeclampsia. In addition to high blood pressure or a value of greater than 140/90, these patients will also have protein in their urine. And again, as I've mentioned before, leaking protein in the urine is a marker of kidney damage. They'll notice swelling. They'll also complain of frequent headache as well as dizziness. Preeclampsia can actually turn into eclampsia. This is considered a medical emergency. In this situation, the only way to really save the mother is delivery of the baby. There are certain medications which we can use to minimize the mom's risk factor for having a seizure, but a lot of patients with preeclampsia to eclampsia can actually develop renal disease, including the need for dialysis. In addition to preeclampsia, eclampsia, hypertension in pregnancy, there's one very severe illness that can be seen, and it's called HELLP syndrome, or HELLP, which is actually an acronym for hemolysis, elevated liver enzymes, and low platelets. In this situation, it can occur during the third trimester or up to several weeks after the baby's been born. There's liver damage that occurs, there's increased risk of bleeding, and we can also see patients require dialysis from renal failure. If you've had preeclampsia before, or have had eclampsia or a complicated pregnancy in the past, I do recommend that you follow up with a high-risk maternal fetal medicine doctor. There are times where we suggest being placed on aspirin to prevent complications from occurring. Again, a lot of that care occurs with high-risk maternal fetal medicine doctor as well as a kidney doctor.
So what is the most common electrolyte problem that you see in South Asians?
So that's a very loaded question because we do see a lot of electrolyte problems. We deal with salt, high or low, potassium, high or low, acid-base disturbances, as well as high calcium. The most common, in my opinion, that I see, at least in my practice, is hyponatremia or low salt level. And, you know, it's very common for someone to say, but you just talked about how managing a low salt diet is very important. So when we talk about sodium problem, it's not just a salt problem, it's almost like a ratio, a salt compared to water problem. And the reason why I think it's most common, and I do find it to be more common in South Asian population where we follow a strict vegetarian diet, we're also taught that drink plenty of fluid because it helps with indigestion and joint pains. And I'm not saying no, but there is no one right answer to this. And that's because there are patients that actually need lots of fluid. So for example, if you were somebody who got kidney stones or had polycystic kidney disease, we're going to encourage you to drink tons of fluid. However, if you're somebody who has congestive heart failure or has liver disease or certain types of kidney disease, particularly that nephrotic syndrome that we spoke about, we're going to ask you to restrict your fluid intake. So the answer is that there's not a right balance. It's when we're not eating enough protein in our diet and we're strictly following a fruits and vegetable diet, because fruits and vegetables are composed of water as well. So our ratio of salt to water becomes off. Now, low sodium can lead to a lot of issues. Patients can present with, I feel dizzy, unsteady, I'm nauseous sometimes, and I'm tired. So it could be severe enough where a patient develops seizures and goes into coma. And more or less, if the sodium fluctuates too quickly, that's also detrimental because that can lead to severe illnesses that are irreversible.
Finally, doctor, is there anything you want to tell us, the viewers who are watching the show right now?
I encourage everybody to establish routine care with a primary care doctor. That routine care should also include your blood work, a urine test to make sure that we're monitoring not just the creatinine, which tells us your kidney function, but your urine, which tells us if there's any protein leakage or blood leakage. I would definitely encourage you to be mindful of your eating habits. Avoid processed foods, saturated fats, canned goods, which tend to be high in sodium. Follow that low salt diet. I really urge you to avoid herbal medications, especially without a discussion with a primary care provider. Minimize the use of medications like Advil, Motrin, Aleve, ibuprofen. Try to avoid those medications that are used for arthritis like Celebrex or Mobic without making sure it's okay with your doctor. early detection and treatment of diabetes and hypertension is actually very important because that'll help reduce your risk for progression of chronic kidney disease. I encourage a very healthy lifestyle, which allows you to regularly exercise, keep moving, balanced diet, avoid tobacco and alcohol intake. Thank you.
Thank you, Dr. Gopika. That was very informational and useful for us. Thank you for taking.
Thank you, Sakshi TV, for this wonderful opportunity. I really appreciate it.